Welcome, dear friends, to an important conversation about beetroot and your health. If you've walked through the health food section of your local grocery store lately, you've probably noticed beetroot products everywhere. From powders to juices to supplements, this vibrant vegetable has become incredibly popular. Many health experts praise its benefits, especially for blood pressure management. However, today we're going to have an honest discussion about some important considerations that often get overlooked when it comes to beetroot consumption. As we explore this topic together, please remember that knowledge is power. Understanding both the benefits and potential concerns about any food helps us make the best choices for our individual health needs. This information isn't meant to frighten you or suggest that beetroot is bad. Rather, it's about helping you make informed decisions that work best for your unique body and health situation. Understanding our relationship with superfoods. Before we dive into the specific effects of beetroot, let's talk about how we think about healthy foods. In our modern world, we often hear foods described as either miracle workers or terrible villains. The truth is usually somewhere in between. Even the healthiest foods can cause problems for certain people, and that's perfectly normal. Each of us is unique, with different health needs, medical conditions, and body chemistry. Sometimes, when we hear that a food is healthy, we assume it must be good for everyone all the time. This isn't always the case. What works wonderfully for your neighbor might not work as well for you, and that's okay. The key is paying attention to how your own body responds and working with your healthcare provider to make the best choices for your situation. Today, we'll explore 8 important effects that beetroot can have on the body. These aren't rare occurrences, but rather documented effects that many people experience. By understanding these effects, you can make better decisions about whether and how to include beetroot in your diet. Effect number 1. Changes in urine color. Let's start with something that might have already happened to you. Have you ever noticed that your urine turns pink or reddish after eating beetroot? This happens to about 10 to 14% of people and has a medical name called beeturia. While it's generally harmless, it can certainly be alarming if you're not expecting it. This color change happens when the red pigments in beetroot pass through your system without being completely broken down. Interestingly, this is more likely to occur in people who have low iron levels or reduced stomach acid. Think of it as your body sending you a gentle message that your digestion might need some attention. If you regularly experience this color change, it might be worth discussing with your doctor. It could indicate that you have low iron levels, which affects many people, especially as we age. Women who have gone through menopause and men over 60 are particularly prone to iron deficiency. The good news is that once you know about it, iron deficiency is usually easy to address with dietary changes or supplements under medical supervision. The intensity of this effect can vary from day to day. You might notice it's stronger when you eat raw beetroot compared to cooked, or when you're slightly dehydrated. Drinking plenty of water and cooking your beetroot can help reduce this effect if it bothers you. Effect number 2, kidney stone concerns. Now, let's discuss something more serious that's especially important for those of us who have had kidney stones or have a family history of them. Beetroot contains compounds called oxalates, which can contribute to kidney stone formation in susceptible individuals. About 1 in 10 people will experience a kidney stone in their lifetime, and if you've had one, you know how painful they can be. Oxalates are natural compounds found in many healthy foods, not just beetroot. When they combine with calcium in your kidneys, they can form crystals that may eventually become stones. This process happens slowly over weeks or months, often without any warning signs until a stone starts to move. If you're prone to kidney stones or have been told you have high oxalate levels, you don't necessarily need to avoid beetroot entirely. Instead, you can take some simple precautions. Eating beetroot with calcium-rich foods like yogurt or cheese can help because the calcium binds with the oxalates in your digestive system rather than in your kidneys. Also, cooking beetroot reduces its oxalate content by about 20 to 30%. Beetroot juice requires special consideration because juicing concentrates the oxalates while removing the protective fiber. If you enjoy beetroot juice, consider limiting it to small amounts and always drink plenty of water throughout the day to help flush your kidneys. Effect number 3. Blood pressure changes. One of beetroot's most celebrated benefits is its ability to lower blood pressure. This happens because beetroot contains natural nitrates that help relax and widen blood vessels. For many people with high blood pressure, this is wonderful news. However, if you already have low blood pressure or take blood pressure medications, this effect needs careful consideration. Some folks, particularly those who naturally run a bit on the low side with their blood pressure, might experience dizziness, lightheadedness, or fatigue after consuming beetroot, especially in juice form. This is particularly important for older adults who might already be dealing with balance issues or are at risk for falls. If you take medications for high blood pressure, heart conditions, or chest pain, it's essential to talk with your doctor before adding regular beetroot consumption to your routine. The combination of your medication and beetroot's natural blood pressure lowering effects could cause your pressure to drop too low, which can be dangerous. Pay attention to how you feel after eating beetroot. If you notice dizziness when standing up, unusual fatigue, or feeling faint, these could be signs that beetroot is affecting your blood pressure. These symptoms are especially important to watch for if you're over 70 or have been diagnosed with any heart conditions. Effect number 4. Digestive sensitivities. Let's talk about something that affects many of us but isn't always discussed openly, which is digestive comfort. Beetroot contains certain types of carbohydrates that can cause digestive upset in sensitive individuals. If you have irritable bowel syndrome, which affects about 10 to 15% of adults, you might find that beetroot causes bloating, gas, or changes in bowel habits. These digestive effects tend to be more pronounced with raw beetroot or beetroot juice. The concentrated nature of juice can be particularly challenging for sensitive stomachs. If you notice discomfort after eating beetroot, try cooking it thoroughly and eating smaller portions. You might also find that your body tolerates it better when you eat it as part of a meal rather than on its own. Some people find that adding ginger or lemon to beetroot dishes helps with digestion. These additions not only improve flavor, but can also help soothe the digestive system. If you have a history of digestive issues, start with very small amounts of beetroot and see how your body responds before increasing your intake. Remember, there's no shame in having a sensitive digestive system. Many people do, especially as we age. The key is finding what works for your body and not forcing yourself to eat foods that make you uncomfortable, no matter how healthy they're supposed to be. Effect number 5. Iron balance considerations. Beetroot can affect how your body processes iron, which is particularly important for seniors to understand. The vitamin C in beetroot helps your body absorb iron more efficiently. This is wonderful if you're dealing with iron deficiency anemia, but it can be problematic if you have a condition that causes your body to store too much iron. Hemochromatosis is a genetic condition that causes the body to absorb and store excessive amounts of iron. It's more common than many people realize, affecting about 1 in every 200 to 300 people of Northern European descent. If you have this condition or a family history of it, the iron-enhancing properties of beetroot could contribute to iron overload. The tricky thing about iron overload is that early symptoms like fatigue, joint pain, and weakness are often attributed to normal aging. If you have a family history of hemochromatosis or have been told your iron levels are high, discuss beetroot consumption with your doctor. A simple blood test can check your iron levels and help determine if beetroot is appropriate for you. For those with normal iron levels or mild deficiency, beetroot can be beneficial. Eating it with other iron-rich foods like lean meats or fortified cereals can help improve iron absorption. Just remember that balance is key, and what's helpful for one person might not be for another. Effect number 6. Blood sugar considerations. Many people are surprised to learn that beetroot contains a significant amount of natural sugar. 1 cup of beetroot juice has about 20 grams of sugar, which is similar to eating a medium-sized banana. While these are natural sugars, your body still needs to process them, which can affect blood glucose levels. For those managing diabetes or prediabetes, this sugar content requires careful consideration. The effect is most pronounced with beetroot juice, where the fiber has been removed. Fiber helps slow sugar absorption, so whole beetroot causes less dramatic blood sugar changes than juice. If you have diabetes, this doesn't mean you can't enjoy beetroot. It just means you need to account for it in your meal planning. Consider eating beetroot as part of a balanced meal that includes protein and healthy fats, which help moderate blood sugar response. You might also want to check your blood sugar after eating beetroot to understand how your body responds. Some research suggests that certain compounds in beetroot might actually help improve insulin sensitivity over time. However, the immediate sugar content still needs to be managed. Work with your healthcare provider or a registered dietitian to determine how beetroot can fit into your individual meal plan. Effect number 7. Medical symptom confusion. Here's something that's rarely discussed but incredibly important. The red pigments in beetroot can cause your stool to appear reddish, which can look alarmingly similar to blood. While this is harmless when caused by beetroot, it can mask or be confused with actual bleeding in the digestive system. As we age, regular screening for colorectal problems becomes increasingly important. The American Cancer Society recommends regular colonoscopy screening starting at age 45 for most people. If you regularly consume beetroot, the red coloration it causes might make you dismiss actual warning signs or create unnecessary worry when there's no real problem. The key is awareness and communication. If you notice red in your stool, think about whether you've eaten beetroot in the past day or two. If you haven't, or if you have any other concerning symptoms like abdominal pain, changes in bowel habits, or unexplained weight loss, contact your healthcare provider promptly. Always tell your doctor about your dietary habits, including regular beetroot consumption, especially if you're having any digestive tests or procedures. This information helps them interpret test results accurately and ensures you get the most appropriate care. Effect number 8. Medication interactions. This final consideration is perhaps the most important, especially since many of us take one or more medications regularly. Beetroot can interact with several types of medications in ways that might surprise you. If you take nitrate medications for chest pain or heart conditions, beetroot's natural nitrates can add to the effect, potentially causing your blood pressure to drop too low. Similarly, if you take blood-thinning medications like warfarin, Eliquis, or Xarelto, beetroot might enhance their effects, increasing bleeding risk. Beetroot can also affect how your stomach absorbs certain medications. Some drugs need specific stomach acid levels to work properly. These include medications for osteoporosis, thyroid conditions, and certain antibiotics. The compounds in beetroot can alter stomach acid production, potentially affecting how well these medications work. The timing of when you eat beetroot relative to when you take your medications can matter too. As a general rule, if you take medications, it's wise to separate them from beetroot consumption by at least 2 hours. However, always consult with your pharmacist or doctor about specific timing for your medications. Safe consumption guidelines. After discussing all these considerations, you might wonder if beetroot is safe to eat at all. For most people, the answer is absolutely yes. Beetroot can be a nutritious addition to your diet when consumed mindfully. Here are some practical guidelines to help you enjoy beetroot safely. For most healthy adults without specific health concerns, eating half to 1 cup of beetroot several times a week is generally safe and beneficial. You can enjoy it roasted, steamed, boiled, or even raw if your digestion handles it well. If you prefer beetroot juice, limit it to about 4 to 5 ounces daily, and consider diluting it with water or mixing it with other vegetable juices. Start slowly when adding beetroot to your diet. Begin with small portions, perhaps a 1/4 cup, and gradually increase while paying attention to how your body responds. This is especially important if you have any of the health conditions we've discussed or take medications regularly. Consider the form of beetroot you consume. Cooked beetroot is often easier to digest than raw. Whole beetroot provides fiber that helps moderate blood sugar impact compared to juice. Pickled beetroot can be a tasty option, but watch the sodium content if you're managing blood pressure. The best approach to beetroot consumption is a personalized one. What works wonderfully for your friend or neighbor might not be ideal for you, and that's perfectly fine. Consider keeping a simple food diary for a few weeks, noting when you eat beetroot and how you feel afterward. This can help you identify patterns and determine what amount and preparation method works best for you. If you have any chronic health conditions, take medications regularly, or have concerns about any of the effects we've discussed, please talk with your healthcare provider. Bring this information with you and discuss how beetroot might fit into your overall health plan. Your doctor can consider your complete health picture and provide personalized advice. Remember that nutrition is just one part of overall health. Regular physical activity, appropriate for your fitness level, adequate sleep, stress management, and staying socially connected are all important for healthy aging. Beetroot can be part of a healthy lifestyle, but it's not a magic solution to health challenges. Thank you for taking the time to learn about these important considerations regarding beetroot. Knowledge truly is power when it comes to making health decisions. By understanding both the benefits and potential concerns, you're better equipped to make choices that support your individual health needs. Remember, the goal isn't to create fear around healthy foods, but to promote informed decision-making. Beetroot remains a nutritious vegetable with many potential benefits for the right people in the right amounts. The key is finding what works for your unique body and health situation. As we age, our bodies may respond differently to foods than they did when we were younger. This is normal and simply means we need to pay closer attention and adjust accordingly. There's wisdom in listening to your body and respecting what it tells you. If you found this information helpful, please share it with friends or family members who might benefit. Open conversations about health and nutrition help all of us make better choices. Remember to work with your healthcare team, stay curious about your health, and never hesitate to ask questions when something doesn't feel right. Your health journey is unique to you. By staying informed, asking questions, and paying attention to your body's signals, you're taking important steps toward maintaining your health and independence as you age. Here's to making informed choices and enjoying good health for many years to come.